When we look at the transformation of healthcare in the U.S. today, the opportunities that are available for pharmacists are really remarkable. Given the number of patients with chronic diseases, the complexity of medications that are being released. Years ago, traditionally, patients were treated with oral pills, and yet today we're seeing the advent of biologics, sometimes infusion therapies, that are treating debilitating chronic diseases that in the past we couldn't even treat. All of these really represent opportunities for pharmacists to make a huge difference. And when we think about what our role is, it's fundamentally ensuring the safe and effective use of medications. I like to think about pharmacists as part of the three-legged stool in the care of the patient. Physicians prescribe and diagnose and have their intentions of what they feel is best for the patients. And oftentimes, patients see multiple physicians. And so we have this phenomenon, polydoc, which results in polypharmacy. And that's essential given the complexity of chronic diseases patients have. But that also helps us define where we can make a difference, given our knowledge and skills in medication therapies. We really are the guardian angels of the medication use process, if we think about it. So if we look at what that really means, it starts with the order being written, and we as pharmacists oversee the procurement of the medications, that we have to make sure that the right medications are ordered and stored appropriately. Oftentimes, really severe errors occur due to storage of medications incorrectly. For medications that need to be compounded, there are now national standards to ensure the safety of that sterile compounding process, and actually this area is being examined as an area of specialization for pharmacists. Historically, that wasn't the case, and so that represents a new opportunity for individuals to really advance in that area who have expertise in ensuring safety of sterile products. Once the medication has been prepared, the pharmacists who've been evaluating those orders play a key role in ensuring the safe administration of those medications, and that's where we work very closely with the nursing staff to ensure the right rate of medication, to ensure that any monitoring that needs to occur concurrently is occurring, especially for medications that require monitoring right around the time the dose is being given. And if we really think about how this whole process begins, we have the knowledge and training to look at that patient. The orders are in the context of that patient. So current diseases, other concurrent medications, those are the things that we bring to the table. Our understanding of those facets of the patient's care are essential to ensure that drug therapy is carried out with the intent that the physician had in mind and are administered safely. So that's where I think of us as the guardian angels, if you will, of the medication use process. So let's now think about a patient as they enter our systems and what our role really is. If we think about it, a patient's only within our walls for about 5 days. That's the average length of stay in hospital settings. So let's walk through that process. Patient shows up in the emergency department. We have pharmacists who are trained as specialists in emergency department medicine. And whether the patient's admitted for a stroke or a trauma or a pediatric patient where dosing is really critical, we're there at the bedside to make sure that process is safe. Once the patient's admitted, if they end up in a critical care unit, our critical care trained pharmacists are really intensivists. And much like the medical model, we make sure that any critical issues around that episode of care are managed to ensure safe and effective drug use. As patients transition to the next level of care, our pharmacists who work in areas like med-surg really are like hospitalists. So if we think about the medical model, it's very analogous. And at that juncture, we're trying to look at any other acute issues that we need to manage. But we need to start thinking about why is the patient here and what are they going to need when they go home. So this is where I really look at the patient as a whole and our role to ensure that not only are the acute care needs taken care of, we start to think about what's that patient going to be needing at discharge. We need to engage our outpatient pharmacy in evaluating whether or not that the patient's medications at discharge make sense. Was anything omitted? Up to 20% of the time, we might actually find an error, which is what our data shows. And so our outpatient pharmacists play a critical role in evaluating those discharge meds, again, in the context of what the patient was here for during their inpatient hospitalization. We oftentimes identify problems with antibiotics, anticoagulants, sometimes antiplatelets. I call it the triple AAA of pharmacy. Our triple aim is to ensure safe use at discharge. We've also identified that this transitions of care that patients undergo as they leave the hospital is a very vulnerable time for patients. And research studies that we have done with our residents who've been instrumental in helping us develop this program demonstrate that when we call patients post-discharge, we actually make a difference in terms of a reduction in readmissions. And our residents have developed algorithms to help us risk stratify the highest risk patients, those who don't understand their meds and therefore aren't adherent. And those are the ones we target for post-discharge follow-up. So what we've seen at Cedars-Sinai is that the opportunities to really make a difference occur across the organization. And the demand has grown as a result of the relationships that pharmacists with training and knowledge bring to the table. And regardless of where the patient is, we have been able to develop collaborative relationships that enable us to really make a difference in the care of the patient. I've spent my whole career at Cedars-Sinai. I started here as an intern, and the reason I stayed is I looked at the remarkable opportunities to make a difference in patient care. Establishing relationships with physicians and nurses has really been the best part of my career. Being able to hire pharmacists who are really committed to patient care has created a demand for pharmacy services. When I began as director, we had 44 pharmacists. We are now up to 180, and that isn't due to anything I did. It was about identifying individuals who were trained and really committed to patient care. I always say that I'm passionate about this profession and about patients. One of the residents a number of years ago created a button for Pharmacy Week that says "Must Love Pharmacy," and it was based on conversations I'd had with staff about, every patient, every medication, every dose that we evaluate, dispense, and administer to patients counts, because any one of those can cause harm or can cause good, which is the ultimate goal is to treat the patient's underlying condition. So over the years, it's been really, really important as we recruit and hire people to help them continue to advance and develop their knowledge and skills, and let them utilize and leverage their passion for the behalf of our patients. And I think that's probably why we've grown so much, is that as physicians and nurses interact with pharmacists, they see what a vital role we play, because medications are the mainstay of treating underlying conditions. So when I think about what's important to individuals who are looking at how they want to spend their career, it's really finding a place that really cares not only about patients, because that's our first and foremost responsibility, but an environment that's going to help individuals grow and develop and nurture them. And really that is our primary mission here. I always say to the pharmacists, my first responsibility is to our patients. My second responsibility is to each of you, to help you figure out what your passion is and to help you leverage your knowledge and your background to achieve your personal goals. Because if we're able to do that, then the beneficiary of that is our patients. And what's more important than that?